Hey everybody, welcome back to the show. I feel very self-conscious because I think our next guest might figure out that I'm actually nuts.
Yeah, Fiona told me this was actually my intervention coming up here. Dr. Joti Samra joining us, clinical psychologist. She is also the president of the BC Psychological Association, and she also happens to be one of the people that helps out with a TV show all about animal hoarding. Dr. Joti Samra, hi, how are you?
Hello, I'm
So,
thank
first
you.
impressions for both, no, I'm kidding.
Well, here's my clipboard.
Do people react, I mean, when they find out that you're a psychologist, and do you see some behavior tweaks when people first find out?
Well, it's funny because I actually hate telling people what I do.
Because
right?
they would
You're
have
at a
that
party,
reaction.
you meet someone that doesn't know you, and they ask you what you do, and you think, oh, really? Yeah. So I try and think of creative things that I can kind of make up.
Well, maybe you can tell us, what is it that you do as a clinical psychologist? Because you do so many different things, but how do you describe it?
Yeah, well, I do a number of things. I've got one of the things that I do that people most commonly associate with psychologists is I maintain a private practice. So I see patients at a medical clinic. Yep. I see adults and couples provide treatment, and the most common psychological health problems are depression and anxiety, and couples treatment, and workplace stress. And workplace stress is actually an area that I specialize in. So I do a lot of organizational consulting, so working with companies and organizations and teaching them how to create psychologically healthy workplaces.
Because stress management can make your job and your life so much easier. Because we all have stress, but some people more than others, but it's just figuring out how to work it out.
Yeah, absolutely. And we know if you look at the changing nature of our work, now work has really changed, right?
Yeah.
With computers, with people working remotely, with Blackberries and iPhones and iPads, it's nonstop. and you hear, I mean, I know I do it myself, right? You wake up in the middle of the night and what am I reaching for? My Blackberry. To see what emails have come in.
It's not healthy.
What usually causes companies, just out of curiosity, and we're going to talk about other stuff, but what usually makes companies sort of come to you? Do they have that aha moment where they realize that the workforce is under too much stress, or is it usually just part of an ongoing process?
Well, you know what, there's a couple of things that are happening. One, we're seeing there actually are some legal trends now where employers have an obligation, a legal obligation to create a psychologically healthy workplace, which is new. And people are starting to recognize this. The other thing is people really are noticing the impact. And we know if we look at depression or anxiety, about 25% of Canadian adults will have a major depressive disorder or an anxiety disorder at some point in their lifetime.
Really, that high?
It's really high. And if you look at the long-term disability stats for disability insurers, upwards of about 40 to 50% of claims are mental health related.
Very expensive.
Now we wanted to talk about
expensive.
reality television because you've also been asked to be a consultant on Animal Hoarders, the television show.
How did this happen?
And I mean, obviously you're a clinical psychologist, there's all sorts of things that you do, but how did you get approached by this program?
Yeah, well, it was one of the really interesting things that I do. I actually have a forensic specialty. And in my kind of past life, I used to work in a number of forensic settings, including child protection, and would get called in by the Ministry of Children and Family Development in a range of situations where kids were at risk. And actually, that was my first experience working with individuals that hoard. So I've got some clinical background in that area. It's actually quite a rare, infrequent condition, and it's not one where people typically present for treatment. Like, I don't have people coming to my practice saying, I've got this as a problem, I want to come in. They're usually getting flagged because there's some concern.
I mean, it's one of those things people are very, very private about. We've all seen it on television because I guess it's just become a trend in reality TV that hoarding is one of the things that people are focusing on. We always think of the crazy cat lady, the woman with 100 cats, but what other kind of animal hoarders are there? Well,
there's a range, and yes, the kind of, the cat lady person, and certainly about 2/3 of hoarders or more are women, and cats are the most commonly hoarded animal. But I've worked with individuals that hoard birds, so a range of exotic birds, and it's amazing actually how chaotic.
Elephant hoarders?
Not elephant, but most recently.
Just one is hoarding enough, I think.
Pigs, llamas, horses, and now,
Really?
and I know it sounds like a farmer, but actually, in fact, there were 67 cats and 15 dogs. I worked with an individual who collected exotics, so had iguanas, tarantula, about 60 rats, actually.
How do you qualify whether somebody is a hoarder or they just want to care for things? Because, I mean, there are people out there, say, who have 20 horses, but they have the property for them. They have the facility to feed them and that sort of thing. So how do you qualify as a psychologist when somebody is actually a hoarder? Well,
that's a great question, because you're right. You can have, I mean, every farmer we would call a hoarder, right? If we just looked at number of animals.
Oh, my God, they've got 100 cattle.
You are a cow hoarder.
But what you're looking at, there's two things you're looking at. One is that the individual is unable to control their kind of urge to collect these animals, and there's some significant impact in some important area of function. So they're not able to either maintain occupational function, be able to work, not being able to maintain basic self-care, not being able to maintain social relationships. So it really interferes with quality of life in a huge way. And the other thing that you're looking at is the health of the animals. So again, to qualify as a hoarder, there's significant impact on health. And in fact, you actually will see quite unhealthy or unfortunately uncared for unsanitary conditions.
Is hoarding a psychological condition, or is it part of a usually a bigger condition and a bigger problem and bigger issues with people, or is it sort of separate?
It's one, it actually doesn't show up in our DSM, which is the kind of psychiatric, psychological Bible.
Oh, I'm totally familiar.
Yeah. Oh, yes.
Oh, the DSM. Yes.
The DSM. But there's a range of presentations, and the best we understand is that many hoarders actually meet criteria for an anxiety disorder, and often an OCD, obsessive compulsive disorder. There's very high rates of trauma history among individuals that hoard, particularly animal hoarders. And you think about it, right? It makes intuitive sense. When you think of if you guys have animals, you're a cat lover, right?
My sister is the cat lady, though. She's got 4 of them.
She's the cat.
Not a hoarder.
Not a hoarder.
But why women, though? You said 2/3 of hoarders are women. Why women? Why does it present more with them?
Well, when you look at kind of childhood history of trauma, we know the rates are higher among women, right? So that's in terms of one of the prognostic factors or etiological factors. It makes sense that we would see a higher percentage of women. And individuals often have quite significant physical and sexual abuse trauma histories. And really with the animals, it's different than what we call object hoarding, which is things, right? So animal hoarding, people often at a very young age develop these very close connections with animals, and often they realize that, or they learn to kind of have this belief that animals are the only ones that they can trust, these animals provide them comfort, that they can't trust people and relationships. And then you kind of go through, and when I'm getting the history on these individuals, they've often had a range of trauma experiences in their life, and then they gravitate towards animals.
And that's where you come in on the show to do the intervention, I guess, of sorts.
Yeah, so I'll be called by often family members. So it's often a partner or a child or children that have seen their loved one start to kind of decline over the years.
Spin out of control a little bit,
no one wakes up this way, right? And that's what we have to remember. I know it's easy to, you can watch these shows and people say, well, how could that ever happen? And how would someone get to that point? But almost all of the individuals I worked with have been very functional at points in their lives and had very kind of what we would call normal attachments to animals throughout the bulk of their life, and then have a number of experiences that end up leading to this circumstance. All of them will say, this is not what I imagined, right? So they look at their life, but they don't know how to get out.
Well, Joti, thank you so much. And
we just scratched the surface.
I know.
My
we'll have
goodness.
to have you back to talk about more. It's absolutely fascinating stuff. Thank you so much.
Joti.
You can go to Joti's website to find out more information. And of course, you can catch her on Animal Hoarders.
Very nice. We're going to take a break. When we come back.